cranial nerves and sensory system monitor all 5 senses: sight, hearing, smell, taste, and touch, as well as the ability to speak, swallow, and perceive temperature and other sensations. If they don't function properly, a person can lose the ability to experience and communicate with the world at large. To help you evaluate these vital functions, this program will show you all the steps of a complete neurologic examination. Here you'll see normal findings. In your practice, you may note the same findings, normal variations, or abnormal findings.
Before examining the cranial nerves and sensory system, consider their anatomy. The nervous system includes the central nervous system, which consists of the brain and spinal cord, and the peripheral nervous system, which consists of 31 pairs of spinal nerves and all their branches, as well as 12 pairs of cranial nerves. The cranial nerves enter and exit the brain and primarily innervate the head and neck, allowing sensation, movement, and parasympathetic control. The spinal nerves arise from the spinal cord and supply the rest of the body. These nerves enter and exit the cord through roots, sensory afferent fibers through the posterior or dorsal roots, and motor efferent fibers through the anterior or ventral roots. Pain, temperature, and crude touch sensations follow the spinothalamic tract. They enter the dorsal root, synapse, cross to the opposite side, and travel to the thalamus, where they synapse again and carry the sensation to the sensory cortex for interpretation. Position, vibration, and fine touch sensations follow the posterior columns. They enter the dorsal root and move up the spinal cord to the brainstem, where they synapse and cross over. Then they travel to the thalamus, synapse again, and go to the sensory cortex.
Have you been exposed to any?
During the health history, keep in mind that the neurologic disorder you're most likely to see is a cerebrovascular accident, or stroke, and that strokes are 2.5 times more common in blacks than in whites, and almost twice as likely to be fatal.
No, not to my knowledge.
Problems with coordination, like
As you take the person's history, also perform a screening examination of the mental status.
tingling.
Be sure to note the level of consciousness, use of language, mood, orientation, memory, and thought processes.
Good. How about
If he seems well and has no significant history findings,
any other type
perform a screening neurologic
that you
examination.
could think of that may
If there are neurologic concerns or signs of neurologic dysfunction, perform a complete neurologic examination, as shown here.
And go ahead and get changed, and I'll be right back, okay?
All right, thank you.
You're welcome.
When examining the sensory system, remember to follow these guidelines. Make sure the person is alert, cooperative, and comfortable. Compare sensations on symmetrical parts of the body. Map any decrease in sensation by systematic testing in that area. Keep the person's eyes closed when indicated. Explain what will happen and exactly how he should respond. And avoid asking leading questions. If the person has abnormal mental status, or if you suspect an intracranial lesion, test cranial nerve 1, the olfactory nerve, by assessing his sense of smell.
Again.
First, check nostril patency by occluding one at a time and asking him to sniff.
And I'm gonna need for you to tell me what you smell.
Okay.
Okay?
Then, with his eyes closed, occlude one nostril and present a familiar, non-noxious aromatic substance, such as vanilla, coffee, or mint. Normally, the sense of smell is intact, and the person can identify an odor on each side of the nose.
Lemons.
I'm gonna give you this card.
To test cranial nerve 2, the optic nerve, assess visual acuity with a handheld vision screener. Have the person hold the screener at reading distance about 35 centimeters from his eyes,
7
and hold an opaque card over one eye.
WM00X31.
Good.
Test each eye separately.
Okay.
Normally, a person can read without hesitancy or moving the card closer or farther away.
EWM00X31.
Good.
Also, perform the confrontation test to assess the peripheral vision in each quadrant of the eye.
What I'm going to do is I'm going to wiggle my fingers, and as it comes into your peripheral fields, I need for you to tell me that you can see it by seeing now.
Okay.
Okay? So go ahead and cover your eye for me. Good.
Now. Now. Now.
Okay, I need for you to look straight for me. I'm going to take a look at your eyes.
And use an ophthalmoscope to examine the ocular fundus, which should display a normal optic disc, which is innervated by cranial nerve 2, as well as retinal vessels, background, and macula.
Check cranial nerves 3, 4.
Cranial nerves 3, 4, and 6, the oculomotor, trochlear, and abducens nerves, mediate eye movement, and the oculomotor nerve mediates pupillary constriction. So test these cranial nerves together using 3 techniques. First, inspect the palpebral fissures, which usually are nearly equal in width. You should see no lid drooping, strabismus, or nystagmus, back and forth eye oscillation. Second, check the pupils, which should appear round, regular, and equal in size, and should display brisk, direct, and consensual light reflexes, and a brisk response to accommodation
So
testing.
use your eyes just to follow my finger.
Third, assess extraocular movements by leading the person's eyes through the 6 cardinal positions of gaze. You should note parallel tracking of your finger with both eyes. You also may detect a few beats of normal nystagmus during extreme lateral gaze. If you find any other nystagmus, note its presence in one or both eyes, type of movement, such as pendular or jerk, amplitude, frequency, which may be constant or fade after a few beats, and plane, which may be horizontal, vertical, or rotary.
Okay. Mom, would you hold her head for me?
When testing extraocular muscle function in a preschool or school-aged child, have the parent hold her head so that she tracks your movement with her eyes only.
I'm going to check cranial nerve 5.
To test the motor function of cranial nerve 5, the trigeminal nerve, assess the muscles of mastication. Palpate the temporalis and masseter muscles as the person clenches and relaxes his teeth. The muscles should feel equally strong on both sides.
Again, please. Relax.
Now test the sensory function of cranial nerve 5. With the person's eyes closed, ask him to say now whenever he feels the touch of your cotton wisp.
Touch your face. I need for you to tell me when you can feel me touch your face by seeing now.
Okay.
Okay, close your eyes for me.
Then lightly touch the wisp to his forehead,
Now.
cheeks,
Now. Now.